Hello, my name is Michael. I'm a Senior MRI Technician with the iMed network. I thoroughly enjoy the capability of being able to image a vast array of pathologies and anatomy. It's about dealing with different sorts of people every day. It's about answering their questions. MRI scans don't use any ionising radiation or X-rays. They use magnetic fields and radio waves to produce your imaging. For this reason, it's perfectly safe for your child to have an MRI scan. The receptionist will go through a detailed safety questionnaire with both yourself and your child. It's very important to answer this questionnaire correctly. It is for your safety and your child's safety. The reason we ask so many questions is because the magnetic field is so strong. We need to be certain that nothing goes inside our MRI room that may interfere with either the test or the safety of yourself and your child. Although the magnetic field is very strong in an MRI, it will only affect things that have a magnetic component. So any artificial joints, screws, fillings, etc. won't be any problem for your child having their test today. Like most things with children, one of the most important things is a positive attitude before having the test. Please spend some time with your child, explaining to them that this test is a very important test to make them better, that it won't be a very long procedure, that it won't hurt, and all they have to do is keep very still during the procedure. They can bring their favourite teddy or toy, as long as it's not magnetic. They can also bring some music if they'd like to listen to it during the procedure as well. Please reiterate that they will be 100% safe and that you'll be there looking after them as well as we. During your child's procedure, you are more than welcome to be inside the room with them. How long the scan will take will greatly depend on the imaging that we need to do. Typically with children, the scans are fairly quick and can range somewhere between 10 to 20 minutes. At the time of the procedure, we will bring your child in so that they can remove all their metal objects before they enter the room. If you are going into the room with your child, you'll need to remove all your metal objects, watches, phones, keys, and place them in the lockers provided so that you don't bring any metal inside the room either. During your child's scan, we will place a coil over the anatomy that we're imaging. This coil will vary depending on where we are taking the pictures. The machine itself is very noisy, so we will give your child some hearing protection. Often this hearing protection is just a set of headphones that we are able to play some music in, so please make sure your child brings their favourite music CD to help them through the test. They will also get a call button during the procedure. They can just give it a squeeze and we'll come in and see to their needs. The scan itself is painless and your child won't feel anything other than a very light warm sensation during the test. Often, your child will need to fast for a couple of hours before the procedure. This is because for some MRI examinations we require a contrast injection. The injection we use is a contrast medium called gadolinium. It's very safe. The gadolinium we use in MRI is not the same as the iodine we use for CT and X-rays. So if you're allergic to iodine, you may still be able to have gadolinium very safely. In incredibly rare instances, you may have an allergic reaction to gadolinium, no different to any other drugs. Our radiographers and radiologists on site are well trained to be able to deal with these reactions, and you're in good hands if anything was to happen. We find that most children can get through the procedure these days with current machines without sedation. However, as we're all aware, for young children it can be very difficult for them to stay still or tolerate the procedure. It is important that you talk to your referring doctor about what sedation your child may need. One of the most important things that you can do is reinforce with your child that it is a very safe test, that you will be with them during their test, and that it won't take very long to be able to perform. With this combination of positive reinforcement and faster scan times, it can be possible to be able to perform your examination on your child without sedation. Unfortunately, we can't give you a result straight away. Once we've finished your child's scan, we will give these images to a dedicated radiologist. It takes the radiologist some time to properly look and evaluate your films to be able to give your referrer a diagnostic report. So you'll need to go back to see your referring doctor to be able to get the results from your scan today.